Dr. Pat, and we're here today with Steve Birdwin. And Steve Birdwin is a 16-month-old Quaker parakeet. He's in for a recheck. He's had a history of some high liver enzymes on screening labs, so we're rechecking those today. He's clinically normal, but high liver values in a bird can be a cause for hidden disease concerns, so we are checking him to make sure that nothing else is going on. In the interim, the owners have corrected his diet. They have him on a really good diet. He's currently on CHOP with Harrison's and no junk food, which is really important with birds, and so we're hoping these values have improved in that time frame. Quaker parakeets, great little birds, wonderful pet birds. The normal color is green, where all this beautiful blue is, with the little gray cap and the gray chest. He's a blue mutation, and as you can see, very striking. They're a bright vivid blue, and he's kind of turquoise color. So beautiful blue mutation Quaker parakeet. So Quakers are also called monk parakeets because of their little cap. And Quakers are an interesting bird species in that Quakers are one of the only parrot species that builds communal stick nests. They build apartment complexes. And I've been in aviaries where there've been dozens of Quakers nesting at once. For one thing, it can be deafening because they're very loud, but it's pretty adorable because they will have stick nests lined all above your head in a huge complex larger than most trees, and you'll see little Quaker heads poking out of all the nests. And then they raise their babies in a communal setting. They're a South American bird. They can live 20 to 30 years. I've seen many in their 30s. They're generally pretty hardy. And in general, a pretty easy bird to keep and maintain. They can be territorial and sometimes nippy, so we always want to work on training and socialization with them when they're young. And as you can see, they've done a really good job with Steve Birdwin here. He's a very loving, very social bird, and he loves his beak to be rubbed. He's such a baby still. But the training and socialization does need to start early and be continuous, just like you would with a puppy. If you get a new puppy, you would train it. And that training is an important part of enrichment for birds as well. And Quakers are pretty busy, active birds, so enriching the cage environment and the house environment is very important. Enriching activities basically mean taking a reward that's of value to them, usually a treat, and giving them a tiny bit of reward for a lot of effort. And so kind of the classic example is to use a toilet paper roll or a paper towel roll or a little paper Dixie cup, and you may put one little seed or one little nut in there, something he doesn't normally get in his daily food, and you wad it all up and he has to tear it apart to get out this treat. And you do lots of those. And again, the idea is a lot of effort, little reward, keeping the mind and the body busy, so we don't have a bird that's just sitting alone in his cage waiting for you to come home. The cage should be a fun place for him that he's interacting with fully. And so that's really important for Quakers because they are pretty busy. They're very intelligent. They're also really good talkers. They learn often to talk really early in life. An important thing to note with Quakers is they are illegal in some states, mainly because of their stick nests. So they like to build their apartment complexes on power lines, which is generally frowned upon in most states. And so there are certain states like Chicago, I believe, has banned them now. There are several other states, so check your state. And they've naturalized to certain areas, which is how they've started building on power lines. So they actually can do really well in our environment, which is not a good thing for the bird or the species. So in general, we want to make sure that if we have a flighted bird, we have a strong recall, so you can always get that bird back to you, and that's part of the training that we teach them early. In a dog, I would teach them a word like now. When we use now, it's different than come. It means this is urgent, you get to me as fast as you can. And the way you teach that is reward-based. And so, again, an example of a dog, you may give a little cookie or treat for come. For now, you may give a little bit of baked chicken. So high value, come to you urgently. We do the same thing when we train a bird recall. We use a special word that we would only use at that time, and the highest value treat that we can offer them, something they really want and crave and will always come to you. So very important if you have a flighted bird, and particularly with these guys because they do naturalize quite easily and readily. That's the monk or Quaker parakeet, a wonderful species. This is an update on Sterling, our little baby African gray parrot with an angular limb deformity of his left leg. He was adopted from a pet shop, and the owners were told that all of the clutch had leg issues, with Sterling being the most affected. He is able to grasp and move his toes, but he cannot place his left leg in a downward or normal position for perching. The right leg is completely normal on physical exam. His radiographs revealed no evidence of trauma or any kind of bony lesions other than some angular limb deformities. This is likely a lesion that occurred in the shell as he was growing and developing in the egg. At this point, these lesions cannot be fixed or repaired, so we're working on supportive care and perching and housing to make his life easier. He has a dedicated family who loves him and will do all that's needed for a good life. Okay. Hello, it's Dr. Patt at Little Critters, and we have a beautiful Amazon with us today, and we're just trying to hold her close because she is a flighted bird, so she likes to take a flight around the exam room. And we're showing her today because she has an interesting lesion going on with her beak. If you look at the top beak, the maxillary beak, you can see kind of the irregular grooves all the way down by both nostrils, but more importantly, you can see the pink on each side of the nostril here, and you can see the actual thicknesses or different layers of her beak. Now sometimes I will see grooves like this in birds that have had chronic nasal discharge, and as we get nasal discharge it'll actually form grooves in the beak. She has no history of that, but what she does is pretty compulsively rub the top of her beak between the bars of her cage, and she's actually worn the surface or the keratin layer down, and you're seeing the vessels underneath, which is the pink area. And this can be a behavioral problem in birds with boredom, with hormonal problems, with stress. They can act out. Frequently we see feather picking in birds. This would be another manifestation of it. And so an important thing to do with a bird like her is, one, we're working on her nutrition to make sure the nutrition's ideal. It's okay, baby. I know, you're a good girl. So we're making sure that we have really good nutrition. She's actually not biting, she's holding. She's a good girl. So that she has a balanced diet. She's right now predominantly on a seed diet. So we're working on converting her to pellets, to chop, to lots of variety of vegetables. And then more importantly, equally, we're working on enrichment. So starting foraging behaviors, working with things like clicker training for birds. Very important to divert their attention from the inward to the outward and just provide a more satisfying, fulfilling life. So if we see some abnormal lesions, always get them checked out by your vet, and then kind of critically assess what the bird's doing in the house, the behavior, and any stressors. The owner did note that this was the most stressful of their birds. They have an Amazon as well, and this one tends to be the one that exhibits more stress behaviors. And certainly the beak lesion fits with that. Where are you going? You going for a walkabout? You are? You're a good girl. Okay. Hello, have you seen a 35-year-old Senegal parrot? You have today. So today we're discussing senior bird care, very important, often under-discussed issue in birds. Our birds live a long time and they develop many of the same issues that we see in our dogs and cats, and we're going to discuss what to look for and how we take care of it. And hello, I'm Dr. Patt with Little Critters Veterinary Hospital, and if you love animals, like learning about their needs, or just want to provide better care, give us a like and a follow. So this is Lucibel, and again, she's 35 years old. She's been owned by the same person her whole life. She was actually raised and hatched out by this wonderful woman. She's taken great care of her, but she's noticed a few things that have changed over time. So her grip is a little less secure. She's a little more cautious when she's climbing. She's obviously a very well-loved, very socialized little parrot. She is and has been on an exceptional diet, and this is an important point with all of your parrots or birds in general, is to make sure their nutrition is adequate. And adequate means a balanced variety of foods and not a seed-only diet. And so many birds that we see develop atherosclerosis or heart disease later in life because they're on only fatty seeds, and they develop people problems as they age. So we have Lucibel on a pellet diet. She does get some seeds, she gets chopped, she gets a variety of vegetables, and this is all preventative as your birds age. Regarding her grip being a little bit less secure and her moving a little more cautiously, the most common thing we'll see is arthritis. And you probably didn't realize birds get arthritis just like we do, just like dogs do, and they don't express it as readily or easily. But what we'll often see is they may sit on the perch, and instead of gripping, they may sit flatter on the perch. Their fingers may have little lumps and bumps, kind of like mine, where their little toes kind of deviate at different angles. They often don't climb as much. And if we have diagnosed a bird with arthritis based on radiographs seeing the bony destruction, then we do anti-inflammatories for them just like we would with a dog or cat. So we control the pain, we reduce the inflammation, we work on just general health to make sure there's no other causal factors such as gout. And that's probably the most common thing I see in senior birds, tied often with heart disease. So if you have a parrot, particularly if they're getting older, watch them move, be aware of how they move, and make sure that they are seeing an avian veterinarian very regularly, because they're going to pick up more subtle signs that you as an owner may not see because you see the bird all the time and it's become normal. And an avian vet may look at the bird and say, this isn't normal, we need to address it to improve quality and comfort in life. But again, Lucibel, 35 years old, and she's here today because she's had wonderful care. So it's very possible and achievable. Hello, it's Dr. Pat with Little Critters, and we have a wonderful surprise today. A little baby bird. This little guy is only 14 days old, and you can see he still is in his little dinosaur stage. He's just getting his little pin feathers in, just getting the tail in, and he looks like a dinosaur that'll turn into a butterfly. He obviously has a big problem. So if you look, he has a splay leg. So this left leg is splayed out to the side. He can bring this leg in, actually. When we help him or aid him, he will bring it back, but he is automatically abducting or splaying the leg out. This is a very common problem in baby birds. He was bred in a nest box with the parents. It was a wood nest box. It did have bedding in it. What the breeder noticed is that the parents were, she said, kicking the actual bedding out, and that would result in a more slippery surface. And when baby birds are slippery, they will start to splay their legs out to the side, and then we get abnormal tendon and ligament development that doesn't allow them to contract it. The other possibility is something like an egg developmental problem, where the egg isn't rotated or developed correctly, and so we end up with developmental abnormalities as well. But at this point, this leg is still able to be malleable and to actually adduct or go inward. In when we hold it there, it's in a pretty normal position. So we are going to hobble this little one. We do that with extreme caution. If you put hobbles on a young growing animal, they can get too tight, they grow into them, and then we have a bigger problem than we had with the leg. She had tried hobbling him at home, but he was able to continuously get out of the hobbles. So we're going to do some work on him and give him a chance. There is a low possibility of success at this stage because he's already grown quite a bit in the 2 weeks he's been on planet Earth. But we're going to give it the best try we can in the hopes that we can get 2 normal legs. Has anyone figured out what kind of bird he is? He's definitely not a budgerigar. This is a scarlet-chested parakeet. And we'll put a screenshot up of what these guys look like, but they truly turn into butterflies. These are beautiful Australian grass parakeets. And the scarlet-chesteds literally have a scarlet-chested. He's actually a violet mutation, but he's a wonderful little baby and well worth trying to save. And we have Blanca with us today. Hello, it's Dr. Pat with Little Critters, and we have Blanca here today. She's a 27-year-old umbrella cockatoo, and Blanca is in today because she is due for a superlorn injection. Have you heard of superlorn? Do you know what it is or what it's used for? We'll go through that. Blanca has a history of being spayed at another hospital many years ago, and after she was spayed, she continued to have hormonal behavior. Have you ever had a cockatoo? Do you know if they're hormonal? How can you tell? What do they do? Typically, cockatoos are little bundles of hormones. They're a wonderful bird, but umbrellas are often thought of as the chickens in the parrot world because they will lay eggs and reproduce very prolifically. And they're very emotional birds who love to be cuddled and scratched and held by their owners and will bond strongly with their owners, and then think that should stimulate reproductive behavior in them. And the problem with reproductive behavior in cockatoos is they will strain, and as they're straining, so they'll posture, they'll flatten their wings, they'll lift their tail, and they'll strain their cloaca. And when they're doing this, it's actually leading to a prolapse of the cloaca. And it's stretching and dilating it, and over time they have chronic prolapses where they're literally falling out through their cloaca. And this is a very common problem in cockatoos. She did have reproductive surgery with a reduction in her cloaca, or a tightening of the cloaca, again by another hospital several years ago. And unfortunately that didn't resolve the problem, which is pretty common in these guys. And she does have some fecal incontinence or some leaking now that the owners are dealing with. And she continues to have the hormonal behavior. In spite of being spayed, they still have hormones that they produce, and it'll create the same behaviors. And so we use superlorn in these birds. We used to use Lupron quite a bit years ago, but now we use the deslorelin implant. And that implant is just injected under the skin, and some people will inject it in the muscle in the breast or under the skin over the back. And it looks like a little rice grain, and it slowly dissolves over time, but while it's present, it's actually suppressing her hormones because she has a hormone problem. And it's suppressing a lot of the hormones and the behaviors. And some of the behaviors can be very destructive behaviors in addition to the straining and the prolapse. You can see that she feather picks, she does chew on her ankle a bit. And I've seen much more severe cases where they're stressed, they're frustrated, and they act out. It is very important to suppress these behaviors. You also have to do environmental control and owner control. And so what that means is we don't want to pet them over their back or under their wings, because this is mating behavior and it will stimulate more hormones. So you really should be focusing only on petting the head so that you're not creating the problem. You also want to control the light cycle, so we don't want them up all night, because we're often up very late in the night, which is extending their daylight hours, and that puts them in springtime or breeding mode. So it's much better to have a very dedicated day-night cycle and a cage in a night room that's totally dark and quiet, so they're not sleep deprived and not stimulating hormones. And then in addition, we should be doing foraging activities with these guys for environmental enrichment, stimulating their brain, focusing on other activities. But the superlorn is often a lifesaver in many of these birds with very severe problems. So we often augment all of the environmental modifications with something like a superlorn injection. So we're going to be doing that today for this beautiful little girl. We have a cockatiel here today who was in for his annual checkup, routine blood screening, a fecal. He is a 23-year-old cockatiel, so he is geriatric. And there are some important things to think about as your cockatiels get older. We see many of them in their 20s. We had one in that was 31 yesterday. And some of the things that I look for in particular are arthritis. So just like we can get arthritis in our hands, they often will get it in their feet. You'll sometimes see kind of swollen joints or a little bit deviated fingers, just like we get as we get older. I have many of those. He's very cute. He got into some orange here in his cage. This is not his coloring. Cockatiels can live a long time. They're exceptional pets, highly recommended. As you can see, they're very loving, very bonded and tame with their owners and usually with others as well. They like shiny things, so they'll chew on anything shiny. So you want to be careful not to put things in the cage that may have heavy metals in them. I've had many birds that have had toxicity getting into Christmas ornaments with lead and zinc toxicity. So always be aware of that. I usually don't recommend putting mirrors in the cage. They'll often obsess over the bird in the mirror and spend all their time looking at and talking to the bird in the mirror, so we usually don't do that either. As we get older, we make sure that the strength in the feet is still good, that we're walking normally, that we don't have swollen joints to the feet. And if we do start to develop that, there are anti-inflammatories that we can put them on that really help with pain and can make a big difference. Also very important to make sure that their diet's good. A lot of times these birds haven't eaten the best diet for a large part of their life, and we try to gradually improve that. They can be pretty stubborn, but with gradual transitions and some special aids, I like Harrison's birdie bread, works really good, and you can dice up veggies and bake it in the birdie bread and give that a try. And we can often coax them to eat a little healthier. Birds do get cardiovascular disease, just like humans. They can get heart disease. So at the exam, we listen to the heart, we listen for murmurs and arrhythmias, and we can treat many of those things. Diet correction is often a part of it. There are medications. Your cockatiel can be around a very long time. Wonderful choice, very smart. They can talk, they whistle a lot, and just real loving, sweet birds. We are here today with Ho-Oh, which I'm told is Pokemon. And she's a little 20-week-old, just a baby, green cheek conure. And she's a pineapple, which is a color mutation, which is why she has all these beautiful dramatic colors. She's like a little mouse, she scurries. You can see all the coloring on her belly and her head. Beautiful, wonderful little birds. These are great pets, highly recommended. Conures can live a very long time. As you can see, they're very sweet and very loving, generally very healthy birds. She does have a band on her leg, so we're going to remove that today. These bands are very dangerous. They get hooked in things and then they break their legs. So we always take them off. They don't provide any kind of permanent ID for her to be able to get back to you if she's lost. I wanted you to meet her because she's a beautiful little girl. She's on a great diet, which is really important. Birds, you want them on a balanced pellet diet. You have some seeds. They should use chopped or cooked whole grains and veggies. Minimal sugars or fruits, those are junk foods, and you don't want them on all the junk food we eat. Definitely not good for them. Regarding that too, no kissing. We don't want oral contact or having them eat off of our plates because birds have staph in their gut and we have E. coli and we can give that to them and make them sick. So we want to be really cautious with that. But wonderful companion animals. And definitely very busy little girl. We have a little hand-fed baby cockatiel here. We're just showing her because she's beautiful. She's a pearl white face, so they don't have the yellow on the face that we often have in the male cockatiels and to a slighter extent on the females. We have white instead and then all the pearl markings. She's actually very gentle, but a little crabby. Cockatiels are wonderful pets. I've said it before, but I highly recommend them. As a pet, they can't be beaten. Much easier to care for than the big, large birds, which can be very loud and destructive. They live a long time. We commonly see them in their late 20s to early 30s. I think we have one we're seeing right now that's 32, so they can be around for quite a while. They like to gripe at you, which is what she's doing. She'll tell me exactly what she thinks I should do. And you'll notice she'll put her head down. As soon as we start petting, then there she goes. Then she'll say that's an acceptable behavior from me. So she's educating me. She's a very good girl. Dr. Pat with Little Critters, and we're back with Remy today. Remy's a little bit of an interesting case. So she's in for just a biannual and a checkup. But one of the things that we're finding currently in Arizona is we just had a lot of rain. Apparently 2 monsoons came through Arizona, not something I thought I would ever say. And we had what for us was a very significant amount of rain over several days. And so we've had more reports of owners finding mold in their home, which generally we never encounter in the desert. And Remy is one of those. And the owner is a very astute owner. She's in the veterinary field, and she found mold in the air conditioner ducts. And so she brought her in for a checkup to make sure that she hasn't been affected. She has no respiratory signs, no clinical signs. But just an important point, particularly if you live in the South or in areas where we see much more mold prevalence, birds are highly sensitive to molds. They can get into their air sacs. They have a very unique respiratory system. So they have lungs that are not inflatable, and they have a little ostium that then goes into air sacs, which I describe as little cellophane baggies all throughout their body, where they provide gas exchange, and mold can settle into these areas, and it can be very toxic and a huge problem for birds. So it's very important to make sure that you don't have a mold problem for your safety and definitely for the bird safety in the house. More commonly in Arizona, we'll see mold like aspergillus due to dirty litter trays under the cage. So if you have birds, keeping those cage bottoms clean and dry is very important. I've seen a lot of people use the little corn bedding, and that does grow a lot of mold, so I generally discourage using that. I just have people use newspapers and then clean them up every single day so we don't have moisture or any fungal contaminants. Hello, it's Dr. Pat with Little Critters, and we have Bob with us today. And she is 26 years old, and when she was 15 years old, Bob decided to start laying eggs. And so then they knew that Bob was actually a girl. And so we are a geriatric or senior citizen now. And you can see we're sitting a little bit abnormally. And it's because she's starting to get foot and toe arthritis. You can see some of her toes are bent. She's having a harder time perching and gripping. She can, but it's much harder for her to move her toes and to grip safely on perches. And so the owner just noticed that she was starting to fall a little bit and having balance problems. You can also see that Bob has a history of feather destructive behavior. She's been chewing or plucking feathers for a very long time, many years. This toe issue is very common in birds, and it's something that I see in almost all geriatric birds at some point in life. My fingers have it, just like all of ours tend to get. But in birds, it's a huge problem for them because they will start to lose their balance. They'll fall and injure themselves. I've seen injured keels when they fall, and obviously it's painful. And so we're running a blood profile today to check kidney and liver values, and then we'll be putting a prescription of an anti-inflammatory on board, which is very similar to what we would take for inflammation or your dogs would for arthritis, and can greatly improve the quality of life and make a real difference in their comfort and their ability to grip. We will be checking the blood and making sure there's no evidence of gout and other problems. Again, this is very, very typical in senior birds and something that we can do something about. And Bob is older now. She hasn't laid eggs in many years, but Bob became a girl when she laid eggs at 15 years old. We'll do another video on feather destructive behavior or feather picking, but that's a common problem that we see in birds. Foraging enrichment and good nutrition, all very important. Not reinforcing the behavior is also very important. And you can see as she attempts to perch, I'm just balancing her and making sure her grip's okay. You can feel on my fingers that she's just not gripping very hard. So we're going to get her more comfortable and make sure we get her so that her quality of life is as good as we can make it for as long as we can make it. That's Bob.